But we are glad that we are here and we are doing this and we are talking about that which concerns us as women. Yes, so for everyone that will be joining, for everyone that will be watching the replay, so we're happy to be here. One thing we need to understand is God is not just interested in our spiritual lives alone. That's why 3 John verse 2 says, Beloved, I wish above all things that thou mayest prosper and be in health. That means our health is very important to God.
Okay.
So that's why we're having this discussion today to talk about our health. We being women, is our health important to God? How can we figure out the issues that concerns our menstruation, our menstrual cycle, our breast, taking care of our breast and all? This is a one-on-one session that we need to have. So that's why we're here today.
Yeah.
So with me, we have Dr. Debbie, Dr. Deborah is here. She's a medical officer that's practicing at the moment, and she writes a lot about health, well-being, and that's why she's here to talk to us as women, to talk to us as people that need to be healthy in every aspect of their lives. So that is why she's here today. So please help me welcome Dr. Debbie. You're welcome, Mama.
Thank
So happy
you.
to have
Thank
you.
you. Yeah. Thank you for
So
having me in
happy
the
to have
house. Yeah.
you.
I'm glad to
Yeah,
be
we're
on
all
the Radiant
excited.
Woman Show. Yes. Yeah.
Yeah,
Yeah.
so
Thank you for
happy to
having
have
me.
you. Thank you
Yeah.
so
Thank you
much.
for the
All
Radiant
right.
Woman Show. Yeah. I think
Oh,
it's blessing a lot of lives. Yeah. And I hope
oh,
God uses it to bless more lives.
amen, amen,
Amen.
amen. Thank you so
Amen.
much, Baba.
Yeah.
All right, I think let's just dive in already. So today we have a long one, but let's see how God will help us for us to bring together everything and then see how we can learn what He wants us to learn. So, Mama, let's talk about it. It's first of all, let's know: is it really important that we take care of our health? Because sometimes we feel that, okay, I'm spiritual, I'm a child of God. It doesn't really matter what happens to my health. It doesn't really matter what I do or how I do it. So, is it really important? Is health really important? Like considering your health and the things that concerns your well-being, your hygiene and all, is it really important?
Okay. Well, yes, health is very important, not just because we're medical people, not just because, we prescribe good health as medical people, but I think the Bible also prescribes good health. Right from, from beginning days when God was always talking to humans, he planted a whole garden for human beings, for Adam and Eve, and he gave the
Mm,
instruction, eat of all the fruits, knowing that fresh things, good food was what life. And talking to the children of Israel, he would always give commandments. These are the things you should take. These are the things you should
mm,
avoid. These are the stuff you should eat. These are ones you should leave out. And all of that. So I think, yes, God is already interested in our health. He's not just interested in our spiritual being, not just interested in our physical relationship with Him. He's also interested in our physical well-being, how well we live. Because we look at it, the spirit cannot survive without the physical body. No matter how
yeah.
much we try, no matter how holy, no matter how spiritual we may be, if our physical bodies are not intact, the spirit cannot survive. So yes, God is interested, heaven is interested, I am interested in your health, your parents are
Yeah.
interested in your health, everybody is interested in your health. So yeah, our physical health are good and they should be good. Yeah.
Wow. So it's very important. As much as we say, okay, we are believers, we are children of God, we are godly women. Yeah, so your health is very important. So the main things or the main aspect of today, let's talk about the woman and her menstrual cycle. Let's talk about it. Yeah, so um Do you have a background to it? Will you like to tell us? Yes, so many people. I believe we have people that may be watching this that either teens that need to know more about
Yeah.
it, and then people that have been going through it. Please, probably people in their 30s or in their 40s that are going, they are still, and those that probably have stepped into menopause.
Yeah.
So can we talk about, okay, what's it all about? What is, okay, maybe probably what's menstruation? Let's start from
Okay.
there.
All right. Okay. So I think it is a part of life. Menstruation, menstrual cycle. It's a part of the female life, female reproductive life. Through it, except maybe there are some challenges which are abnormal. Yeah, but literally every woman is designed to go through the phase of menstruation, menstrual cycle, and it's this month we've really been emphasizing that menstruation to be a talk everybody should be involved in. It shouldn't just be a thing of we discuss behind closed doors, or a thing where we are stigmatized about. Girls feel very, a little girl cannot just talk about like, oh, I'm going through my period, I'm having no, like, it's, there's a lot of stigma, a lot of hiding. Yeah, although people see it as disgusting, but no, it's the beauty. It's what makes us women. It's what makes us who we are, and I think that's a lovely thing. It's a physical part of life. It shouldn't be something that should limit any woman. Shouldn't be something that should stop you from achieving your dreams. It shouldn't be something that should stop you from being what and who you want to be. Okay, seriously. Ngozi Okonjo-Iweala, she probably menstruated. All these great women, Dara Koyili, they all had their menstrual cycle. They had children, they have
Yeah.
stuff. Yeah, so it's a part of life, the natural process of life. So yeah, what is menstruation? What is the menstrual cycle? Well, literally in the layman's term would say menstruation is the weeping of the uterus. Right? Now some people would call it, what is the uterus? So your uterus is the womb, what you call your womb, okay, the inner reproductive organ. And literally they say it's the weeping of the uterus, but that's for the layman. Scientifically, medically, menstruation comes about by a lot of processes that are not just the bleeding. Okay, there's a lot of hormonal changes, there's a lot of body building, there's a lot of, it's influenced by food, it's influenced by your physical activity, it's influenced by, how stressed you are, it's influenced by a whole lot of things. It's even influenced by your mood, okay? So it's not just the bleeding, but coupled with all these things put together, produces your menstruation at the end of the day. And I think we would be missing the point if we just start on menstruation. So we remember we all go through puberty. Most of us did biology in
Yeah.
school. Yeah,
Yeah.
where we talk about that puberty is that transition between childhood and we're moving on to adulthood. So that phase is puberty, and part of what goes on in puberty for women, for girls, for ladies is menstruation. So by the time you start, you enter the pubertal phase mostly around 8 to 10 years. That's the beginning of the puberty phase. You begin with development of your breast, your pubic hair, facial hair, a lot of things. And then I think the crowning of the whole puberty stage is the menstruation, the beginning
Oh,
of
okay.
your menstruation. So that's it. Although yes, the organs continue to develop, but the last thing that occurs as a woman is your menstruation. Okay, so first you have your breast development, you have your facial hair, pubic hair development, and then you have the menstruation. So usually, people would start seeing their menstruation 2 years after they start developing their breast. So let's say you started breast development at 8, you're most likely to start seeing menstruation at 10 or 11,
Hmm.
or you started seeing developing breast at 10, you're most likely to start seeing the menstruation at 12, 13. So that's the cycle of events. So you see how long it takes from developing breast to menstruation. So
Yeah. You're
it's
right.
a long process. Yeah. So there's a lot of hormonal changes. There's a lot of physical growth, physical development. And I think it's not just people. I think that gives a lot of time for the young girl or the young lady to adjust, to the changes. Okay, my body is changing. A lot of things. So it gives you the physical the mental. Sorry, I mean the mental growth and mental well-do to also adjust with time, and I think this is the reason why most pubertal girls are
Yeah.
seen to be more mentally better than the boys, because their own process is a lot longer. They actually develop later than the ladies, and so they sort of mentally are more slower in quotes. Well, that's on the side, but yes, that's menstruation. So the first menstruation you see is what we call the menarche, okay, which occurs 2 years, approximately 2 years after the development of the breast. Menstruation is in a cycle, it's part of a cycle actually. So you have what we call the menstrual cycle. So there is the menstrual cycle, and then there is menstruation. Menstruation is part of the menstrual cycle, okay, but the menstrual cycle is a whole longer thing, okay. So the menstrual
Okay.
cycle has three phases. So you have
Mm.
the menstruation phase, you have the
Mm.
okay, four actually. You have the menstruation phase, you have the follicular phase, you have the ovulation, then you have the I can't remember what the last name is, but there are four phases. So what happens is this: after you bleed, after you see your menstruation, and all of that is cleared away, your body starts laying. This occurs in the inner lining of your womb. Okay, your body starts forming another layer for the next menstruation. Okay, so it starts building up cells, starts putting down layers, starts putting out. It's like building. They are building. They are putting down the layer, putting down the foundation for your next cycle. Okay, when that happens at your ovulation, which should occur in the middle of your menstrual cycle, at the period of your ovulation, your ovaries, that's your egg storing unit, releases one egg, okay, in preparation for childbearing, in preparation for you getting pregnant and bringing the child into the womb. When it releases that egg, so the egg goes into your womb, that's the inner lining, where the bed, the layers have been prepared already. So the layer is supposed to nourish that egg, provide feeding, support that newborn child that is coming out, okay. When this does not happen, because probably you've not had sexual activity and you don't get pregnant, this doesn't happen. So the body has a way of removing all this excess tissue. So the removal of all this excess layer, all these excess cells that have been built, is what comes. Knowing all of these things, even before you start menstruating and before you actually get into that phase, would mentally prepare you for that time. Okay, so yes, I think this is why we should talk more about it. We should speak more about it and educate our girls, educate our sisters. In fact, everybody should actually be your sister. Educate each other that, okay, this is it. This is how life is. Don't just don't be ashamed that you are going. It's part of life. Or just the way people develop breasts, just the way you
Yeah.
look beautiful. Yeah, it's part of your life. Yeah, it's the way it's going to be until probably when you go into menopause, okay, which is the end of the reproductive life of a woman. All right, so that's another topic. But yes, it's part of your life. It will stay with you for a while. At least 20 years of your life, you should be menstruating. Yeah, I think that's it about menstruation.
Thank you so much, Mama. In fact, in everyone at some point, probably, I don't know, I may just be exaggerating, may feel that, okay, menstrual cycle means, but you telling us that, okay, yeah, now, we've actually been going through this and we really don't have a full idea of what it's all about. Thanks so much for that. So, at
Yeah.
some point, you made mention, can we talk about what goes on during the menstruation period? Those things are them natural because some people feel like probably I have a disease, probably something is wrong with me, it's so much pains and all of that. So like people and then probably what is done, feel like okay, come on, but I'm going through this. I don't think I really want to take it.
Sorry, could you take that again? I didn't get you clearly.
Okay, those that go through a lot of pains in the period,
Okay.
yes, is it natural to have those pains? And
Okay.
at what point do you feel like, okay, it's not
Okay. So I think we should just go to why do we have this pain? Okay. I think if we
okay? Yeah.
understand that, it will give us a background. So why do we have the pain? So
Yeah.
your womb is a big muscle. Okay. Just like you have other muscles in your body, your womb is literally just a big muscle of tissue. Okay, shaped that way, and in a way to expel what is inside, it contracts. So contraction is like a squeezing, squeezing motion. So it does that. And during your menstrual period, because of the whole hormonal changes and all, that happens. So it squeezes and pushes out, that whole layer, tries to dislodge that and then push it out. So that is what actually brings the pain. That contracting action that the womb does. Okay, for some people this contraction is way exaggerated. A lot of pain nerve endings around the womb that transmits this pain, and they feel a lot of pain, while for some others, there are not much pain ending, so they don't really feel a lot of pain, but ultimately that action still works. So yes, if you have a lot of pain, it is expected that yes, you should have some pain because of that squeezing action, that squeezing movement of your womb. You should have some pain, but that can easily be solved because the drugs that are formulated for that is either you lose that sense of pain, okay, one, or you take drugs that help to relax those muscles. So in relaxing the muscles, the contraction stops. Okay, so yes, you're allowed to take pain drugs. God did not create any woman to suffer, to be in pain. People are like, no, if I take drugs, I'm not a woman. If I take drugs, I will get you. No, you can never be overdosed on pain medications. No, I will not feel like, no, no, please. You were not born to suffer or go through pain. Okay, so yes, if you're feeling a lot of pain, it's part of it, but please take medications, help reduce the pain somewhat so you can live normally. Don't, menstruation should not be a period where people, I'm not going to school. Why? I'm menstruating. Oh, I can't do this. Why? I'm menstruating. No, I don't feel that. You should even be more active while you're menstruating. Please, bring out the mystery that I'm menstruating and nobody in the whole world knows about it. Yeah. So yes, I think.
Oh
Yeah.
wow. Okay, Mama. But okay, yeah. Truly, I've heard some people say that getting drugs, yes, could be. Are there really side effects to this thing? Yeah, and where do we draw the line? Are there really side effects? And where can we draw the line? Can you hear me?
Um, for the drugs, they're basically just pain medication. So paracetamol, ibuprofen, diclofenac, buscopan. Literally every drug has its own side effects, but drugs are formulated such that 90 at least 90 to 99% of the population can acceptably take them without any massive side effect. Okay, for most of the pain meds, same diclofenac, ibuprofen, I think one of the major it causes ulcer. But aside from that, and that is, it causes ulcer when you take it for a very long period, 2 months, 3 months, not for taking for 2 days. Okay, so yes, the side effects are not really something, they are safe. They're not really something people should be worried about. Whatever makes you calm, whatever makes you, feel good. Some people work with paracetamol, I don't. Some people work with diclofenac, some people work with buscopan. So whatever makes you feel comfortable. Just don't take anything that is addictive. So these drugs are usually not. Just don't take anything that is addictive. But if something relieves your pain, fine. Please, you can do that.
So, from the drugs, are there any natural ways to help ease the pain or anything one can?
Okay, natural remedies. Yeah, people have tried to do a lot of research. People have tried to, do a lot of things just to help alleviate pain. I think one of the most successful therapies so far is exercise. Okay, and maybe not rigorous exercise, just walking, jogging, just being active, it tends to reduce the pain and just relieve all that stress. Okay, so people do that. For me, I think it works. For some other people say they do honey and lemon. I've never tried it, but people say it works. Yes, I think one other successful one is warm pads. Putting warm flutes, taking warm flutes, tea, hot water helps to actually reduce that contraction. Make the body more relaxed and all. You could also use warm pads or fill a bottle with hot water and just put it on your abdomen, your lower abdomen, so it helps to relieve that pain. Although it's short-lived, because as long you have to just place it there and like keep it for a while, but at least for the time being you get some relief and all of that. So yes, walking, some mild exercise. People do lemon and honey. I've not tried it. People do a lot of things, but at least this few I know. Yeah, I advise it. Yes.
Okay, thank you very much, Mike. So for you out there that is going through you're having so pain,
Yeah.
so you can just use any of this. Just try to relieve yourself. So I think let's move to the part of our personal hygiene, starting from menstruation period, because that period you're discharging
Yeah.
a lot of things. So
Yeah.
how can you really, yeah, it's always blood smells. Wow, it's
Yeah.
always very. So how
Yeah.
can we really take care of ourselves that, like,
Yeah.
our hygiene from that period, women normally, how should
Yeah.
our hygiene be?
Okay. I think this is one period where if you've not been taking care of yourself before, please do take care of yourself, okay? Because naturally, blood is a very good medium for bacterial growth, okay? Blood can grow any type of bacteria if you want. Blood can do and undo here. You can actually grow a lot of things with blood. So this is a period where you are not, you shouldn't let yourself, have all that smell, all that, blood around you for a long time, because you could introduce infections into your bloodstream and that can cause a whole lot of things. So daily baths, in fact, not daily. I see people, just take their bath in the morning and then at night they're like, I'll just wash up. It's cold. Please, at least twice a day, at least twice a day. The whole stench and smell. And please change your pads regularly. It's advisable that you should change your pad at least every 8 hours. Okay, depending on your flow, at least every 8 hours. So your pad should be changed. If you double, I know some people double their pads because they have a very heavy flow. You double your pads. If the top is soaked and the down is not, please at least remove the top part. Okay, if you feel like, okay, I don't want to change my pad because money and all, remove the top part after 6 hours so that you have a dry place, okay, to continue pouring in your flow. Okay, so please and then spray perfume. I've seen a lot of girls, they just pass by you maybe after a long day at 6 and oh my god, and you're like, no, please spray perfume. Help yourself so that it become close. We are not perceiving the blood stench. We are getting some lovely scent, even in the midst of all your wetness, we are having some very nice smell. Okay, so I think that is that. And people should not use then one mistake people use tissue paper. Please, that is ill advice. Do not use tissue paper to absorb your menstrual flow. Okay, when you do that, the liquid breaks, those tiny tissues, they just breaks the paper away, and which can start going back into your reproductive tract and cause a lot of problems for you. Okay, so if you can't afford disposable pads and you have to reuse the ones where you reuse, napkins and all, when you wash them, please ensure you hang them outside to dry. Don't hang them in your bathroom, don't hang them in your room. Put them under the sun. Let the sun touch, just like we do with our panties. We put them where there is sunlight, so that because sun kills a lot of bacteria. The action of sunlight does a lot of killing. Put them under the sun, let them be dry before you reuse them. Do not use wet panties, do not use wet napkins. Do not, don't let that area not be wet at any point in time. If your parts are soaked, please find a way to change as often as possible. Do not stay long in wet pads. Some people, their pads are wet, fully soaked, and they're still walking around and like this. Please just find a way to remove that. And I know we are a little cautious, our skirts, for those who really have heavy flow, we stain a lot. Don't wear, your please, please, let's, wear something darker, wear something, that people will not, your nakedness should not be known. Even Bible said, when you let your nakedness not be known, the whole world must not know that you are menstruating. All right, and let's keep ourselves just clean. Our dresses should be clean, our underwear should be clean, everything around us should be clean. Yeah. I'm connected. Okay.
Right, so we're talking about hygiene.
Yes.
Yes, nutrition, hygiene, and I know we'll have to do a part two of this discussion. So if we could just have a way of wrapping up, we'll have to have a part two of this discussion. If we could just have a
Sure.
way of wrapping up about hygiene. Let's talk
Hygiene.
about personal
Okay.
hygiene today, and then having the part two, we can talk about taking care of
Breast.
our breast care, and then any
Okay.
other aspect.
All
Yeah.
right. No
So,
problem.
all
Okay.
right, no problem.
All right. So personal hygiene, I think literally it's what we've been taught, from primary school, secondary school, and everywhere. We've heard a lot about personal hygiene, from the hair to our face to our armpits, our underparts, and everywhere. So it basically is just the same. Okay. We've talked about what we should do during our menstrual period. It does not mean we shouldn't do those things when we are not menstruating. We should take our bath regularly, at least twice a day. Ensure you brush your teeth too, also regularly. People are, I see a lot of dental issues these days because people are not brushing their teeth so well. People are not taking care of their teeth. You should scrub, this is the motion to actually brush your teeth up and down. And
Okay.
you should be on one side like 8 strokes on each side, so like you get 8 strokes, you
Wow.
move 8 strokes and all of that, so that helps. If you notice there are plaques are those, there's this whitey scaly things you find in between your teeth. If you notice there are plaques, please visit a dentist for removal, because the longer they are there,
Okay.
they erode your gums and cause a lot more damage than taking them out. Okay, so please, our teeth are very important. Our hair, you know for naturalistas like two of us, please let's learn to wash our hair. I see people to carry their hair for a long time. People pack their hair 1 month and they've not washed it. Please, 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 your hair is part of you. There's a whole lot of lights. Somebody will spray all the perfume, put all the powder and makeup,
Mm,
and that their hair, man, there's a whole forest
mm.
up there. All right, so please, let's take care in washing our hair regularly, keeping our hair clean. Okay, use products that are good for your hair. If you have a natural hair, I've learned that sulfate free products, all of that stuff, okay, those are the best for natural hair. If your hair, are already, you've damaged them, which is not good, but other products can work for you. So find what works best for your hair. Your general appearance, they say you are dressed the way you dress. Your general appearance should
Yes.
also make sense. Okay, it shouldn't be dressed anyhow. You shouldn't be haphazardly dressed. You should represent who you are on the inside. Don't just say I'm this, I'm bold, I'm cool, but outside they see you're dressing and they're like, who is this? Please represent who you are on your inside. I'm bold, I'm courageous. Let it show forth. Because we are believers does not mean we should dress anyhow. We can be godly and yet beautiful. We can still, slay on the outside and slay in the spirit. Okay? Am I
That's
talking to
right,
somebody?
Mama.
Yes. So please,
Yes,
let's
Mama.
look good. Look good. Our nails, our fingernails, people keep a lot of, I don't know what you do with them, but please, our nails should be kept short. A lot of things hide under our nails that you may not speak out. Okay, a lot of things stays in our nails. Keep your nails short and clean. They are good, not just avoiding damage to your face and your other parts. You prevent a lot of things, okay, that you can easily be transferred to your system. Okay, there's a lot of whole thing on body care, our face, our pimples. People like to pop and squeeze. Please, let's stop all of that. Do not squeeze and pop your pimples. Okay, they usually will just go away. Please pop your face. Do not squeeze and pop all the pimples on, our underpants. I talked a bit on our underpants, keeping them dried, especially if you cannot get sun. If you cannot get sun to dry your underpants, you could iron them out, okay? It is more advisable that you should either use a cotton panty or something you could actually press. So you could press them. If it's silk and you can't directly press on them, place a towel over it and press. Okay, just if you can't sun dry, then press your panties.
So
Then
the
make
heat
sure.
touches it.
Yes, the heat, yeah. So the heat touches it and kills off bacteria and kills off all of that stuff. Okay, there's a whole lot, okay, on physical care. Every part of you should be kept clean. This is the temple of God. God is dwelling in this body. You cannot, no, my God is a jealous God. He cannot come and dwell in a dirty. I think some of us, why God is not using us is because we are dirty. Please. God needs clean people to represent Him. God needs, yes, God needs people that will, He said we will stand before kings and not men. You cannot dress anyhow and stand before kings. You need to look like a queen to stand before kings. So yes, I think with that I will summarize personal hygiene. If there are questions, we would really love these questions and we'll answer them. Maybe on part 2, people can drop their questions and we'll take them up in part 2. So thank you very much. Yeah.
Wow. It's been a session, quite a session. Yeah. Thank you, Dr. Debbie.
Yes.
Amazing. Yeah, so for all our listeners, all those that are joining us, in case you have any question, you can send it to us. You can send it to the radiantwomanshow at gmail.com. Radiantwomanshow at gmail.com. So we'll get to answer and prepare for the part 2 that we'll let you know when it's coming up. So you can join us and then we talk about this better. Oh, Mama, it's been a wonderful time. Thank you.
Yeah, it has.
So many things. That last statement that you said, why God is not using some of us. It's because
yeah.
It's that's to tell you how important it is. God. Yes, it's very important. There's a saying that says cleanliness is next to godliness.
Yes, it
yes.
is.
You need to be clean. For you to be close to God, you have to be, because it's of a purer eye than to behold iniquity. All right, so we are going to thank you very much, Ma. Yes, radiantwomanshow at gmail.com. Yeah, so you can send your questions there and then we'll respond to it. So we look forward to having you in the part 2 of this. Thank you, Dr. Debbie. Yes, Dr. Deborah Essien has poured out her heart to us concerning the issue of menstruation. If you need to catch a replay, please do. You need to watch this again and again so that you get, because these are things that concerns us. We'll be having several sessions like this. We'll talk about different things. Do join us next week Wednesday at 5:30 as we go on with the show and learn what God will have us to learn. Right, Mama, thank you so much. So nice to have you today.
Thank you very much for having me. Yeah, thank you.
We look forward to having you. Thank you so much.
Thank you so much.
Thank you everyone for joining. I hope to have you next week Wednesday.